We had a small idea to get the Edmonton City Police and our staff that work in schools together to see what we can do to support children with addiction and mental health concerns. We were having a situation where the addiction and mental health presentations in the schools was increasing, and we needed just a better way to support these children, families, and schools. One of the outcomes that we've seen, and it was quite surprising, was parents mentioned to us that both them and their children were not afraid anymore to get mental health services because they already had that relationship with the school Edmonton police officer. And the Edmonton police were saying that they no longer felt that they needed to take the children with addiction and mental health concerns to the hospital to receive services because they got what they needed in the schools.
Our project is the Commitment to Comfort Emergency Department Quality Improvement Collaborative. We were able to develop a program to engage staff, patients, and families to improve treatment of children's pain when they visit emergency departments. In our project, we developed materials to engage patients and families so that they would know what types of treatments are available to them when they come to the emergency department. We had found that our staff really already cared quite a bit about children's pain, but we also are taking care of many priorities at the same time, and also some children experience their pain quietly, and so as much as we wanted to treat pain, we were sometimes missing opportunities. So we developed a number of materials so that patients and families would know what was available to them. We have posters with pain scales in all of our treatment rooms to make it easier for patients and families to talk to staff about their pain. I would say one of the most enjoyable parts of the project has been working with teams from emergency departments, large and small, throughout the province, and really getting to know other colleagues that we would not have had the opportunity to meet before, and really make a difference for kids regardless of where in Alberta they go to get their treatment.
Our team uses high quality information about the care we provide to patients with kidney failure to try to improve that care and specifically to increase the use of home therapies for dialysis and improve the timing of dialysis initiation. From a patient perspective, many jurisdictions that are trying to increase the use of home dialysis therapies have done it by removing patient choice. We chose instead to clean up the process of care and have been successful in growing home therapies as a result of doing that. I think the other thing is that no matter where you are in the province, if you have kidney failure and you start dialysis, you're going to get a standardized approach. You'll get educated about your treatment options. You'll be allowed to make an informed decision, and then we'll help you get on the therapy and start it at the right time. I think from a provider perspective, rather than taking a top-down approach where people often get disillusioned and don't feel part of the process, this is really much more of a grassroots movement. So the people that collect the data, that design and implement the interventions to improve care, are the same people that are taking care of patients every day in practice. From a health system perspective, because we were able to achieve our objectives and increase the use of home therapies, improve the timing of dialysis initiation, we were able to save the healthcare system about $6 million over the first year of the program. We've been doing this for a long time, and this is the first time we've done it at scale at a provincial level. The first lesson, I think, is the importance of having high quality information on which to make decisions. And that information needs to be tied to a process of care that drives an outcome that you're interested in. When you have that, you're able to, with confidence, identify areas that are problematic and help teams design and implement interventions to target those areas and to try to improve. It also allows us to make sure that when we make changes, there's no unintended consequences to what we do.